Welcome, everyone, and thank you for joining us today. I'm excited to present to you a comprehensive overview of aerosol drug therapy and nebulizer technologies. Today, we'll explore different types of nebulizers, how they work, their clinical applications, and important safety considerations. Over the next few slides, we'll dive into these topics to give you a clear understanding of this essential area in respiratory care. Let's get started. Welcome to this comprehensive overview of aerosol drug therapy and nebulizer technologies. On this slide, we're focusing on Chapter 40, which is dedicated to aerosol drug therapy. This chapter is fundamental because it covers the core principles and applications of delivering medication through aerosols. As we explore this chapter, you'll see how these therapies are essential in managing respiratory conditions. We'll discuss the various types of nebulizers and their roles in treatment, emphasizing how technology has advanced to improve patient outcomes. Understanding these concepts helps us appreciate the importance of effective drug delivery in respiratory care. Throughout this chapter, we'll connect these details to the broader theme of optimizing therapy to enhance patient health and safety. Now, let's explore the comprehensive overview of aerosol drug therapy and the different nebulizer technologies involved. Nebulizers are primarily used for bland aerosol therapy, which means delivering aerosolized medications or other therapeutic agents to patients. They are also used for continuous drug administration, providing a steady flow of medication over time. When we look at the applications of nebulizers, we see that there are different types based on the volume of medication they can hold. For instance, the small volume nebulizer, or SVN, typically handles between 5 to 20 milliliters, making it suitable for shorter treatments. On the other hand, the large volume nebulizer, or LVN, can hold up to 200 milliliters, which allows for longer or more intensive therapy sessions. Nebulizers are also classified based on their reservoir size, which impacts their usage and efficiency. A key component of many modern nebulizers is the vibrating mesh technology. This type of nebulizer uses a vibrating mesh to generate very fine aerosol particles, which helps in delivering medication more effectively deep into the lungs. There are different types of nebulizer devices, each with its unique mechanism. The vibrating mesh nebulizer, or VM, uses high-frequency sound waves to produce aerosolized medication. This technology is known for its efficiency and ability to generate consistent particle sizes. Then we have the ultrasonic nebulizer, or USN, which also uses sound waves but operates with ultrasonic frequencies to create the aerosol. Lastly, the pneumatic or jet nebulizers utilize compressed air to generate the aerosol, making them a traditional yet still widely used option. In summary, these categories of nebulizers, pneumatic, ultrasonic, and vibrating mesh, each have their specific applications depending on the clinical scenario and medication type. Understanding these differences helps us choose the most appropriate device for effective nebulizer therapy, which is a vital part of respiratory care. Now, let's take a closer look at the power sources behind most nebulizers. Many of these devices rely on high-pressure oxygen or compressed air to generate the aerosol. This supply can come from different sources, such as a portable compressor, a compressed gas cylinder, or even a standard wall outlet providing 50 psi. This flexibility allows for various clinical settings and patient needs. Focusing on pneumatic, or jet, nebulizers, these devices operate by using a high-velocity jet of air to create the aerosolized medication. This method has been a mainstay in aerosol therapy for quite some time. Their simple design makes them reliable and effective for delivering medication directly to the lungs. Throughout this presentation, we see how understanding the different nebulizer technologies, including pneumatic jet types, helps us optimize therapy and improve patient outcomes. This foundational knowledge is crucial as we explore more advanced and efficient aerosol delivery systems. When it comes to aerosol drug therapy at home, using the correct nebulizer system is absolutely essential. Following the manufacturer's recommendations helps ensure you're getting the best possible performance from your device. Now, it's important to understand that hospital gas sources usually operate at around 50 psi, which is a higher pressure. In contrast, home compressors often run at lower pressures, typically around 10 psi. This variation in gas source pressure can influence how the nebulizer works. Higher gas flow through the jet results in smaller particle sizes, which can make the medication more effectively reach the lungs. Plus, increasing the flow rate can actually shorten treatment time, making the process more efficient. But of course, it's a balance. Too high a flow might cause discomfort or other issues. The design of the nebulizer itself plays a big role in how well it performs. A well-designed nebulizer ensures that the medication is delivered efficiently and consistently. When we talk about nebulizer performance, both the design and the flow rate are key factors to consider. Higher gas flows, typically between 6 to 8 liters per minute, with some systems going up to 10 liters per minute, produce smaller particles and faster treatments. Specifically, pneumatic or jet nebulizers rely on this gas flow to generate the aerosol. So, selecting the right system and setting it correctly is crucial for effective therapy. Overall, understanding these factors helps us optimize treatment and achieve better patient outcomes. Now, let's talk about how humidity and temperature influence the size of particles produced by nebulizers. These environmental factors can significantly affect aerosol characteristics, which in turn impacts how effectively medication is delivered to the lungs. Moving on to the impact on particle size, it's important to understand that higher humidity and temperature can cause particles to grow larger, potentially affecting how deep they penetrate into the respiratory tract. Next, when using Heliox, we need to make some adjustments. Because Heliox has a different density compared to air or oxygen, we typically have to increase the flow rate by about 2 to 3 times to achieve a similar aerosol output. This is crucial for ensuring consistent medication delivery. Considering medication characteristics, the viscosity and density of the drugs themselves can influence how much gets aerosolized and the size of the particles produced. Thicker or denser medications might require different settings or equipment adjustments. Finally, most of the gases used are either oxygen or air. But when Heliox is used, the flow rate adjustments I mentioned earlier become especially important to maintain effective aerosol therapy. And speaking of equipment, pneumatic or jet nebulizers are common devices that rely on compressed gas to generate aerosols. Understanding how these variables influence nebulizer performance helps us optimize treatment for our patients. Let's take a closer look at the small volume nebulizers, or SVNs, and the different categories available. There are 4 main types of SVNs that we typically see in practice. The first category is the continuous nebulizer with a simple reservoir. It's important to note that this type should contain a 6-inch piece of reservoir tubing to ensure proper function. Next, we have the pneumatic, or jet, nebulizers. These are quite common and work by using compressed air or oxygen to generate the aerosol. Moving on, there's the continuous nebulizer with a collection reservoir bag. This is a key feature because the bag reservoir collects the aerosol that's generated during exhalation. The collection bag is attached on the expiratory side of the nebulizer, typically on a T-shaped connector. Now, when a patient inhales from this collection bag, they are actually inhaling the aerosol that was gathered during their exhalation. This process can lead to an increase in the inhaled dose, generally, a rise of about 30 to 50%. Understanding these different categories helps us optimize drug delivery, ensuring patients receive the most effective treatment possible. This overview connects to the broader theme of improving aerosol therapy efficiency and patient outcomes. Let's take a look at pneumatic, or jet, nebulizers. These devices generate aerosol continuously, which means they produce a steady stream of medication particles. To make this process more efficient, some systems use breath-enhanced nebulizers. These incorporate vents and one-way valves to minimize aerosol waste, ensuring more medication is delivered during each breath. Moving on to small volume nebulizers, or SVNs. These come in 4 different categories, each designed for specific clinical needs. One of the most innovative is the breath-actuated nebulizer, or BAN. This device syncs aerosol production with the patient's inspiration, which helps reduce medication waste during exhalation. Now, why is this important? Because by synchronizing aerosol delivery with inhalation, we can significantly improve medication deposition in the lungs. In fact, studies show that breath-actuated nebulizers can increase the amount of inhaled aerosol by up to 3 times compared to traditional continuous or breath-enhanced nebulizers. This is a key advancement in aerosol drug therapy, as it maximizes efficiency and potentially improves patient outcomes. So, understanding these different nebulizer technologies helps us tailor treatments more effectively and ensures patients receive the most benefit from their therapy. Let's take a closer look at the schematic of a small-volume jet nebulizer. As you can see here, the baffle plays a crucial role in the device. It breaks the particles into the appropriate MMAD, or mass median aerodynamic diameter, which is essential for effective inhalation and deposition in the lungs. Now, moving on to the actual device itself. This small-volume jet nebulizer features a tube reservoir designed for liquid drug delivery. The way it works is quite interesting. A high-velocity jet stream of gas draws up the liquid medication through a tiny capillary tube. Once the liquid reaches the gas stream, it's broken up into tiny droplets, creating a spray. This spray is then directed against the baffle, which helps to further refine the aerosol particles, ensuring they're the right size for optimal inhalation. Continuous nebulizers, like the small-volume jet nebulizer we're discussing, are widely used because they can deliver medications steadily and consistently, making them ideal for various respiratory treatments. Understanding how these components work together helps us appreciate the efficiency and precision of aerosol drug therapy. Now, let's take a closer look at the one-way valve functionality. This valve is crucial because it allows the patient to exhale comfortably, while also enabling the bag to refill with fresh air or medication. Essentially, it ensures a smooth, unidirectional flow, which is vital for effective aerosol therapy. Moving on to the nebulizer design, we see the circular registered IISVN, which features a collection bag positioned on the expiratory side of the nebulizer T. This design helps optimize the delivery of medication by capturing exhaled gases and preventing loss of aerosolized particles. Finally, we have the nebulizer with a reservoir bag. The reservoir bag plays a key role by providing a reservoir of medication, ensuring a continuous and consistent delivery during each breath. All these components, one-way valves, specialized designs, and reservoir bags, work together to improve the efficiency and effectiveness of aerosol drug therapy. They are essential for ensuring patients receive the correct dosage with optimal delivery, which ties back to our overall goal of improving respiratory care through advanced nebulizer technologies. Now, let's take a closer look at the breath-enhanced nebulizer. The first step involves breaking the liquid medication into an aerosol. Here, the Peri-LC Sprintair compressor plays a key role by converting the liquid into tiny particles that can be inhaled effectively. Next, as the patient begins to breathe in, a valve at the top of the device opens. This action allows air to flow in, which boosts the aerosol generation, making sure the medication reaches the lungs efficiently during inhalation. Then, when the patient exhales, the same valve closes to prevent the aerosol from escaping, while a flap on the mouthpiece opens to let the breath out comfortably. This coordinated movement ensures that the inhaled medication isn't wasted during exhalation. Finally, the valve mechanism is critical because it manages this process seamlessly. It guarantees that the medication is delivered effectively during inhalation and prevents any loss during exhalation, optimizing the therapy and reducing waste. Overall, this design enhances the efficiency of aerosol delivery, making the treatment more effective and comfortable for the patient. Let's take a closer look at the AeroEclipse II, which is a breath-actuated SVN. This device is designed to deliver aerosol medication efficiently by activating only during the patient's inspiration. This means less aerosol waste, making the therapy more effective and economical. You can easily adjust how it operates by turning the dial on top. This allows you to switch between demand mode, which is breath-actuated, and continuous mode, where aerosol is generated constantly. The breath-actuated feature is especially beneficial because it ensures medication is delivered only when the patient inhales, reducing unnecessary aerosol dispersion. You'll also notice a green actuator button on top. This button serves as a visual cue. It indicates when aerosol is being produced, so you can quickly verify proper operation. Overall, the AeroEclipse II combines efficiency with user-friendly features, aligning with our goal to optimize aerosol drug delivery while minimizing waste. Let's take a closer look at the AeroEclipse II, which is a breath-actuated small volume nebulizer, or SVN. What makes this device stand out is its ability to deliver medication primarily during the patient's inspiration, which helps reduce aerosol waste and makes the therapy more efficient. Now, a key feature of the AeroEclipse II is the mode adjustment. At the top of the device, you'll find a dial that allows you to switch between demand mode, which is breath-actuated, and continuous mode. This flexibility means we can tailor the therapy to suit different patient needs or clinical situations. Focusing on the breath-actuated function, the nebulizer only produces aerosol when the patient inhales. This targeted delivery not only conserves medication, but also minimizes environmental contamination and waste, making the process more efficient overall. Another helpful feature is the green actuator button at the top. When pressed, it demonstrates or shows that aerosol is being produced. This is a useful visual cue for clinicians and patients alike, confirming that the device is working properly during therapy. Overall, the AeroEclipse II combines smart design with efficiency, fitting neatly into our broader goal of optimizing aerosol drug delivery with minimal waste and maximum control. A breath-actuated nebulizer, or BAN, is a specialized device designed to deliver medication directly into the lungs. What makes it particularly effective is that it activates automatically when the patient inhales, which means the medication is released precisely at the right moment. This not only ensures efficient drug delivery, but also reduces waste, making the treatment more effective overall. BANs are commonly used for respiratory conditions like asthma and COPD, where targeted and efficient medication delivery is crucial. They are portable and easy to use, which makes them suitable for both clinical settings and home use. By focusing on inhalation-activated delivery, breath-actuated nebulizers help improve treatment outcomes and enhance patient comfort, fitting well into the broader theme of optimizing respiratory therapies. Now, let's discuss contamination risks during nebulizer use. It's important to monitor the medication cup located below the mouthpiece or mask. Keep an eye on it to ensure it remains clean and uncontaminated. Watch especially for any secretions from the patient that might contaminate the medication cup, as this could increase the risk of infection. Moving on to CDC guidelines for nebulizer maintenance. The CDC recommends that nebulizers be cleaned and disinfected regularly. After each use, rinse the nebulizer thoroughly with sterile water to remove any residual medication or debris. Additionally, make sure that the nebulizer is allowed to air dry completely between uses, as moisture can promote bacterial growth. This ties into infection control issues, which are a critical part of safe nebulizer therapy. Proper cleaning and drying help prevent the spread of infections, protecting both the patient and healthcare staff. By following these guidelines, we help maintain a safe environment and ensure effective treatment. Remember, maintaining these practices is key to minimizing contamination risks and promoting overall respiratory health. Today, we're going to take a comprehensive look at aerosol drug therapy and the various nebulizer technologies involved. This slide ties together many of the concepts we've discussed so far, emphasizing how these therapies are applied in clinical practice. Aerosol drug therapy is a cornerstone in managing respiratory conditions, allowing us to deliver medication directly to the lungs for rapid and effective treatment. We'll explore the different types of nebulizers, their mechanisms, and how they impact drug delivery efficiency. It's important to understand that the choice of nebulizer can influence medication deposition, treatment time, and patient comfort. This overview helps us appreciate the technological advances that improve patient outcomes and optimize therapy. By connecting these points, we see how understanding both the principles of aerosolization and the nuances of nebulizer devices enhances our ability to tailor treatments to individual patient needs, ultimately supporting better respiratory health management. Now, let's talk about nebulizer sputtering. When you notice sputtering, it's important to monitor it closely. Continue the treatment as long as sputtering occurs, even if there's some residual drug left in the nebulizer. That residual volume doesn't necessarily mean the treatment is complete. Sputtering indicates the medication is still being aerosolized. Next, it's crucial to assess the nebulizer output. When sputtering reduces significantly, it's a sign that the output has decreased. This could mean the medication is running out or that the device isn't functioning optimally. Finally, always verify the nebulizer's position. Sometimes, sputtering can be caused by incorrect positioning rather than an actual issue with the medication or device. Ensuring proper placement helps confirm that the sputtering is due to normal aerosolization and not a setup problem. Together, these steps help ensure effective therapy and optimal delivery of the medication. Many respiratory therapists prefer not to use a mask because the nose is such an effective filter. This means that when possible, using a mouthpiece can sometimes be more comfortable and efficient for the patient. The choice between a mask or a mouthpiece really depends on the patient's ability, their personal preference, and what feels most comfortable for them. Now, when it comes to breathing techniques, it's interesting to note that deep breathing and breath holding don't significantly improve drug deposition compared to normal tidal breathing. So, encouraging patients to breathe normally during nebulizer therapy is usually sufficient. Another important point is that slow inspiratory flow helps to maximize aerosol deposition from the SVN. By controlling how quickly they breathe in, we can improve how much medication actually reaches the lungs. Lastly, the technique dependency is different when using a SVN. It's generally less technique dependent than using a PMDI or a DPI. This means that patients tend to have more consistent drug delivery with a SVN, making it a reliable choice in many situations. Overall, understanding these nuances helps us optimize aerosol therapy for better patient outcomes. Let's talk about high inhaled output first. This refers to how efficiently a device delivers medication or substances into the respiratory system. When the inhaled output is high, it means that the medication is being effectively absorbed and can work more effectively in treatment. Devices designed for high inhaled output often incorporate advanced technology to ensure that the delivery is precise and consistent. This is especially important because optimal delivery can lead to better patient outcomes. On the other hand, low inhaled output indicates a less efficient delivery of medication. If the device isn't delivering enough medication into the lungs, it can result in reduced absorption and, consequently, less effective treatment. Devices with low inhaled output tend to lack some of the advanced features found in high-output devices, which can lead to less precision in delivery. When we compare these two, the key takeaway is that high inhaled output generally translates to more effective therapy, thanks to better delivery and absorption. Understanding this difference helps us select the right device for each patient's needs and ensures we maximize the benefits of aerosol drug therapy. Let's talk about high inhaled output first. This refers to how effectively medication or any substance is delivered into the respiratory system. When we have a high inhaled output, it means the delivery is efficient and the medication reaches the lungs where it needs to act. The key here is having the right particle size and distribution, which ensures maximum absorption and ultimately the best therapeutic effect. Now, on the other hand, low inhaled output indicates that the delivery isn't as efficient. This usually happens when the particle size isn't optimal or the distribution of the particles within the inhaled air isn't ideal. When that occurs, less medication reaches the lungs, which means reduced absorption and effectiveness. So, when we compare the two, the goal is always to maximize inhaled output. Achieving that means optimizing particle size and ensuring good distribution. This comparison highlights the importance of choosing the right nebulizer technology and settings to improve drug delivery and patient outcomes. Ultimately, understanding these concepts helps us better tailor treatments for respiratory conditions. Today, I'll be discussing the purpose of large-volume jet nebulizers. These devices are versatile because they can deliver bland aerosol therapy, which is helpful for humidification and other non-medicated treatments. But they're also commonly used to deliver aerosolized medications directly to the lungs, making them a key tool in respiratory therapy. One important application is continuous bronchodilator therapy, or CBT. This involves providing a steady, continuous delivery of bronchodilators to help open up the airways. However, it's crucial to monitor patients closely during this process to ensure safety and effectiveness. Now, focusing on large-volume jet nebulizers like the HOPE Registered Heart Registered. These are particularly effective in treating bronchospasm, especially in cases where traditional dosing strategies don't seem to work as well. They can deliver larger volumes of medication or humidification, which can make a significant difference in managing more severe or resistant airway constriction. So, in summary, large-volume jet nebulizers are essential tools. They're adaptable for both bland and medicated aerosol therapy and are especially valuable when patients need more aggressive or continuous treatment. Their role in effective respiratory management cannot be overstated. Now, let's take a closer look at some specialized aerosol drug therapy devices. First, we have the Small Particle Aerosol Generator, or SPAG. This device is a type of special-purpose low-volume nebulizer designed specifically for treating infants with respiratory syncytial virus, or RSV. It's particularly useful for administering ribavirin, which is marketed as Aerosol. The SPAG produces very small particles, which helps deliver the medication deep into the infant's lungs, ensuring effective treatment. Moving on, we also have large-volume jet nebulizers. These are versatile devices used for delivering larger amounts of medication, often when prolonged or high-dose therapy is needed. They're especially useful in various clinical settings where efficient, large-volume aerosol delivery is required. Connecting this to our overall theme, understanding these specialized devices highlights how tailored our approaches can be in aerosol therapy, whether for infants with specific viral infections or for more general, large-volume treatments. It's all about choosing the right device to optimize patient care. Now, let's take a closer look at the purpose of hand bulb atomizers and spray pumps. These devices are primarily used to deliver medications like sympathomimetics, anticholinergics, anti-inflammatories, and anesthetics directly to the upper airway. Their main role is to help manage conditions such as upper airway inflammation and rhinitis, providing targeted therapy where it's needed most. When we consider the aerosol suspension they produce, you'll notice that spray pumps tend to generate larger particles. This is actually an advantage because larger particles, specifically in the range of 5 to 40 micrometers, are ideal for depositing in the upper airway and nasopharyngeal regions. Understanding the particle size is crucial here. Particles within this size range maximize deposition in the upper airway, making treatments more effective. This is especially important for conditions like inflammation and rhinitis, where localized delivery can significantly improve patient outcomes. So, in summary, hand bulb atomizers and spray pumps play a key role in upper airway management by delivering appropriately sized aerosols that target specific areas, ensuring that medications are delivered efficiently and effectively right where they are needed. Let's take a closer look at how aerosols are produced in these devices. The key component here is the piezoelectric crystal. This crystal has the remarkable ability to convert electrical energy into high-frequency vibrations. These vibrations then generate the aerosol particles that we rely on for effective drug delivery. Moving on to enhanced aerosol output, some nebulizers are designed to produce higher volumes of aerosol. This means they can deliver medication more efficiently, with greater density compared to traditional jet nebulizers. This is especially useful when quick or higher doses are needed. Now, focusing on ultrasonic nebulizers, or USNs, these are a type of device that uses ultrasonic waves to generate aerosol. When we compare them to conventional jet nebulizers, the ultrasonic versions generally outperform in terms of aerosol density and output. They are more effective at creating a dense, consistent mist, which can improve treatment outcomes. Overall, understanding these mechanisms helps us appreciate the technological advancements that make aerosol therapy more effective and adaptable to various clinical needs. Let's look at the efficiency of aerosol emission. The residual drug volumes in nebulizers are quite small, typically between 0.1 and 0.4 milliliters. This means that a larger percentage of the actual dose is effectively emitted as aerosol, making the therapy more efficient. Moving on to the mechanism of VM nebulizers, these devices use either a dome-shaped aperture plate or a mesh with over 1,000 funnel-shaped holes. Electrical energy is applied to a piezoceramic element or a vibrating transducer, which then pushes the fluid through the plate or mesh. This process creates a fine, consistent aerosol that can be easily inhaled. When we talk about vibrating mesh nebulizers specifically, the key components include that dome-shaped or mesh element with many tiny holes and the piezoceramic or vibrating transducer that supplies the energy needed. Overall, these features help produce a steady, efficient aerosol, connecting directly to the goal of optimizing drug delivery in aerosol therapy. Now, let's take a closer look at the mechanism of VM nebulizers. These devices utilize either a dome-shaped aperture plate or a mesh with over 1,000 funnel-shaped holes. When electrical energy is applied, it activates a piezoceramic element or a vibrating transducer. This vibration pushes the fluid through the plate or mesh, creating a fine aerosol that can be easily inhaled. One of the key advantages of VM nebulizers is their efficiency in drug delivery. The residual drug volume remaining after nebulization is quite small, typically between 0.1 and 0.4 milliliters. This means that a larger percentage of the medication is actually converted into aerosol and delivered to the patient, reducing waste. Focusing on vibrating mesh nebulizers specifically, they incorporate advanced technology to produce very fine aerosols consistently. They're designed to minimize drug wastage, which is especially important for costly medications. Their mesh contains over 1,000 funnel-shaped holes, which ensures efficient and uniform aerosol generation. Overall, these features make VM nebulizers a highly effective and efficient choice for aerosol drug therapy, aligning perfectly with our goal of optimizing drug delivery while minimizing waste. Now, let's look at slide 27, which provides a comprehensive overview of aerosol drug therapy and nebulizer technologies. First, it's important to understand that PMDIs, DPIs, and nebulizers all deliver comparable clinical results when they are prescribed appropriately. The key here is proper device selection and correct usage. When used correctly, each device can be effective in managing respiratory conditions. Next, I want to emphasize that the strengths of these aerosol drug delivery systems depend heavily on understanding their specific features. Each device type has its own limitations, and as respiratory therapists, we need to be familiar with these to optimize treatment. Improper usage or choosing the wrong device can compromise the effectiveness of the therapy, which is why education and proper technique are so vital. Finally, selecting the right aerosol drug delivery system isn't just about availability. It's about matching the device to the patient's needs, their ability to use it correctly, and the clinical situation. A thoughtful approach ensures we maximize the benefits of therapy and improve patient outcomes. Remember, effective treatment hinges on understanding both the strengths and limitations of each system. Today, I want to give you a comprehensive overview of aerosol drug therapy and the various nebulizer technologies we use. These therapies are essential in managing respiratory conditions, and understanding the different devices helps us optimize patient care. Aerosol drug therapy involves delivering medication directly to the lungs in the form of tiny particles suspended in the air. This targeted approach allows for rapid and effective treatment, often with fewer systemic side effects compared to other methods. Nebulizer technologies have evolved significantly over time, offering a range of options tailored to different patient needs and medication types. Some of the key types include jet nebulizers, ultrasonic nebulizers, and mesh nebulizers. Each has its unique mechanism of generating aerosols, which impacts factors like particle size, efficiency, and portability. Jet nebulizers, for example, use compressed air to turn liquid medication into an aerosol. They are reliable and widely used, but they can be bulky and noisy. Ultrasonic nebulizers utilize high-frequency vibrations to produce aerosol particles and are often quieter and faster, making them suitable for specific clinical scenarios. Mesh nebulizers, on the other hand, use a vibrating mesh or membrane to generate a fine mist, combining portability with high efficiency. Understanding these differences is key because the choice of device affects drug delivery effectiveness, treatment duration, and patient adherence. Connecting this to our overall theme, optimizing aerosol therapy means selecting the right nebulizer technology tailored to the patient's condition and lifestyle, ultimately improving therapeutic outcomes. Let's talk about the impact of patient technique and device design. As we've seen, clinical efficacy can really vary depending on how the patient uses the device and the specific design features of that device. It's crucial to recognize that even the most advanced nebulizer won't work optimally if the technique isn't correct. Now, when it comes to tailoring aerosol drug therapy, the key is to adopt an assessment-based protocol. This means we evaluate each patient's unique needs and responses and then modify the treatment accordingly. Personalization is essential to ensure the best possible outcomes. Finally, selecting the right aerosol drug delivery system is a critical step. We need to consider the patient's ability to use the device properly, the specific medication, and the clinical situation. By doing so, we improve not only the effectiveness of the therapy, but also patient adherence and comfort. Overall, understanding these factors helps us provide more precise, effective, and patient-centered care in aerosol therapy. Controlling environmental contamination is a critical aspect of aerosol drug therapy. One effective strategy is the use of negative pressure rooms and treatment booths, which help contain and minimize the spread of aerosols. These environments are designed to prevent contaminated air from escaping into the broader clinical space, thereby protecting both staff and other patients. Now, when we look at second-hand aerosol, especially from pneumatic nebulizers, it's important to note that continuous pneumatic nebulizers generate the largest amount of aerosol that can escape into the environment. Since these aerosols pass directly into the surrounding air, they pose a risk of environmental contamination and potential transmission. This brings us to personal protective equipment, or PPE. It's essential to wear appropriate PPE whenever administering aerosols to patients who might have airborne transmission infections. Proper PPE acts as a barrier, reducing the risk of inhaling contaminated aerosols and protecting healthcare providers. Lastly, I want to touch on the health risks associated with certain medications, like pentamidine. When administering pentamidine using a specialized nebulizer like the Respirguard II, caregivers need to be aware of the potential health risks involved. It's crucial to follow safety protocols to minimize exposure and ensure everyone's safety during treatment. Connecting all these points back to our overall theme, controlling environmental contamination isn't just about protecting others. It's about safeguarding everyone involved in aerosol therapy, from patients to healthcare providers. Now, let's discuss strategies for contamination control during aerosol drug therapy. Negative pressure rooms and treatment booths are particularly effective because they help contain and prevent the spread of aerosols into the broader environment. These setups create a controlled environment that significantly reduces contamination risks. Next, we'll look at the impact of continuous pneumatic nebulizers. These devices generate a large amount of second-hand aerosol, because they produce a continuous flow, which means more aerosols are released into the room. These aerosols pass directly into the environment, increasing the potential for contamination and exposure for healthcare workers and others nearby. When administering medications like pentamidine, it's important to recognize the health risks involved for caregivers. Pentamidine is administered using a specialized device called the RespirGuard II nebulizer, and handling it requires extra caution due to its potential health hazards. This brings us to the importance of personal protective equipment, or PPE. For aerosols that could be airborne and pose a risk of transmission, wearing appropriate PPE is essential. It helps protect healthcare providers from inhaling harmful aerosols and minimizes the risk of infection. In summary, controlling environmental contamination involves using proper room setups, understanding the risks associated with certain nebulizers and medications, and always ensuring that PPE is worn when administering potentially infectious aerosols. These measures are critical parts of safe and effective aerosol therapy.